Welcome to Facebook Live. I'm Dr. Jyoti Patel. If you don't know me, I'm a board-certified internist and pediatrician. I'm also board-certified in integrative medicine. And today, thank you for joining me on a topic that's very hot these days, but has been around for centuries. So what is integrative medicine? It's just looking at medicine in a holistic way, using both allopathic medicine and natural means to help people. So today's topic is on intermittent fasting. What is intermittent fasting? It's basically taking periods of eating followed by periods of fasting. For centuries in many cultures, fasting has been part of their religious rituals, but it has some good health benefits as well. So I wanted to talk today about the medical benefits of intermittent fasting. Well, studies show, mostly in animal studies, that intermittent fasting and calorie restriction is about the same in terms of weight reduction, fat reduction, and overall health improvements. But studies also show that less than 20% of people that go on a calorie-restricted diet actually will maintain their lifestyle after a year. So this may be a good option for folks that want to lose weight, who want to help their diabetes or lower the risk for heart attacks or stroke, but don't like going on diets. So intermittent fasting is not a diet. It's actually just a change in pattern of eating. So there are so many ways of doing it. First, let's talk about the most common ones or the most popular ones. One that's called lean gains, where you eat your 3 meals in an 8-hour period of time, and then you fast for 20 hours. For 16 hours. So it's an 8-16 fast. You can also do a 4-hour warrior fast where you eat everything in 4 hours and then you fast for 20 hours. That's been shown to be helpful as well, mostly for athletes or people that are bodybuilding. For the animal studies that were done on intermittent fasting, they did an alternate day fast where the rats were given feeds for 24 hours and then were put on a fast for 24 hours. Consider even doing it for 2 days in a row, followed by 5 normal days of eating. So what did the studies show? What did intermittent fasting actually do? It helped with reducing weight, helped with slimming the waistline, helped with lowering body fat, helped with lowering cholesterol. It also helped with cognitive function, decrease in memory decline. It also helped with longevity. So just know that it can also increase your lifespan. A lot of other cultures have incorporated intermittent fasting to increase their lifespan. What are some of the contraindications? What can you not do or not be when you're intermittent fasting? You can't be pregnant. We don't recommend it for children. If you have a fragile diabetes, you shouldn't be doing it. If you have a fragile health condition like a myopathy where you're wasting, this is not a good idea for you as well. But in general, most people can incorporate some type of fasting. Think about doing it maybe once a month, doing it maybe twice a week, starting out by just squeezing your meals in an 8-hour period of time instead of 10. So for example, if you normally start your meals at 10 o'clock in the morning, you finish off at 6 p.m. Doesn't seem too bad. If you like to eat later, maybe you start eating at noon and you finish off eating at 8 p.m. and then you fast through the night. That's my favorite type of fasting. I really like people fasting through the night. There's multiple reasons why, but let me explain. It has to do with hormones. So we have a hormone called growth hormone. In general, that helps us with burning fat. It peaks in the middle of the night. So when you eat it late in the evening, it spikes your insulin and drops your growth hormone. So you're not fat burning, you're fat storing. So if you fast during this time, keep your insulin levels low, your growth hormone levels are going to be super high. So think about doing a 12 to 8 type of meal plan or a 10 to 6 type of meal plan. So that way you're always eating in an 8-hour period of time. If you're really trying to get your blood sugars down, if you're really trying to reverse heart disease, maybe you can shrink it to a 4-hour period if that makes sense to you. If you don't like going without food, remember that what's allowed is water, broth, tea, black coffee. Some people say you can add a little heavy cream, or you can add a little coconut oil. It just depends on your diet style whether you want to add those things in. You can add in apple cider vinegar, something that's very good for detoxification of the liver, helps clean up a lot of the liver in the evening hours when your body is repairing and restoring. So think about adding intermittent fasting to your protocol, especially if you're not a dieter, especially if you don't feel like you want to struggle with calorie restriction. This is so easy. You can eat what you normally eat. Of course, I recommend cutting out the processing, the diet sodas, the junk food, the refined sugars, and trying to eat a whole food, plant-based diet. But try to squeeze your meals into an 8-hour period or 4-hour period of time every so often, even if it's just once or twice a week. So if anyone out there, hi Maria, if anyone out there has any specific questions about intermittent fasting, again, my intention today is to share the information that I know, not to diagnose or treat, but I'm more than happy to help anyone that has any questions about intermittent fasting. One of the cool things, I saw this study that I thought was really amazing. I wanted to share this with you. It was on rats, and what they found was that when they put the rats on intermittent fasting diet and then induced ischemic heart injury by occluding their left anterior descending artery, which is the main artery to the heart, those rats that did intermittent fasting were more resilient to ischemic injury. They also showed that they improved their survival. So isn't that interesting that it improves oxidative stress? It helps make the rats more resilient to injury, to illness. So this type of eating pattern may have some other benefits of lowering inflammation, improving resilience. It kind of reminds me of when blueberries are in the wild versus farmed. If they're under a certain amount of stress, they have more potent nutrients, more potent antioxidants from that stress. So think of intermittent fasting as a way to improve your resilience, to improve your cellular oxidative stress potential, and reduce your inflammation. So think about adding this into your meal plan, maybe once or twice a week. Start out by just doing 3 meals a day. Try cutting out the extra snacks. Next, after you've got your meal to 3 meals a day, try to squeeze it into that 8-hour period of time, and then see how you feel. You should have more energy. A lot of people tell me they feel tired all the time. This actually helps with fatigue. So if you're one that has a lot of aches and pains, you have a lot of fatigue, you may want to try this for a time or two and see how it makes you feel. Also helps with sleep and cognition. So there's a lot of good studies to show that there are some neurocognitive benefits. Let's talk about diabetes. Diabetes is the leading cause of memory loss in this country. We talk about the sugar being toxic to nerves, causing neuropathy, but we never really address the fact that the brain is a bundle of nerves. And diabetes and elevated blood sugar and elevated insulin levels leads to cognitive decline. So when you go on intermittent fasting, studies have shown that it lowers your insulin levels, it lowers your insulin-like growth factors, it lowers your blood sugar levels, and thereby protecting your neurons further from injury. So think about that as well. That really helps folks that want to get their diabetes under control, but they just struggle with their blood sugars. Something interesting about fat. Hey, Jim. So something interesting about fat is, we always talk about abdominal fat, visceral fat as being bad for you, but people don't know why. Why is visceral fat bad for you? It's because it's not inert like we've been told. It's actually an active organ that secretes, when it becomes excessive, it's dysfunctional. It actually secretes inflammatory cytokines, and it secretes hormones that dysregulate our insulin. It makes us, one hormone in particular is called adenopectin. Adenopectin on the fat cells makes us sensitive to insulin. But when you have dysregulated fat cells, large amounts of visceral fat in your belly, that actually causes your insulin to become resistant. So when you start losing that belly fat, your insulin starts working for you again. So another reason to consider intermittent fasting is it actually has been shown in rat studies to reduce abdominal fat. Another hormone that is a critical one for folks that have trouble losing weight is leptin. Leptin tells the brain you're done eating. It's the stop eating hormone. But when you have a large amount of dysfunctional abdominal fat, that leptin doesn't work anymore. It's like a child that's been telling the parent over and over and over again, and it just stops listening. So your brain stops listening to that leptin because just the dysfunctional fat cells are no longer communicating with the brain, and the brain just doesn't know when to stop eating. Another hormone that affects feeding is called ghrelin. It actually is in the stomach, and it sends a signal to the brain telling us we're full. And unfortunately, that gets dysregulated as well when we start putting on more abdominal fat. So there's so many reasons why losing weight, working on that abdominal fat, knowing that it's not just about dieting, it's about changing your hormonal balance, and changing your pattern of eating goes along with your circadian cycle, which is, diurnal. It works morning and night. So if you cut out your eating at night, you actually thrive better in terms of fat loss and metabolism. A lot of people tell me their metabolic rates are so slow. No matter how much they try, they can't lose weight. It has to do with their hormones. And if we try this intermittent fasting, stop eating, in the evening hours, do a prolonged fast for 12 to 16 hours, we might be able to get that hormonal cycle working for us again and help us lose weight without trying too hard. So bad news for women. The studies do show that men have the advantage. Again, they tend to do better with intermittent fasting. They tend to lose more weight. They tend to lose more abdominal fat when they start going for periods of time without eating. But that doesn't mean women can't try intermittent fasting. I just recommend that if you are trying to lose weight, maybe you stretch to that 16 hours instead of the 12-hour fast if you're a woman, just to help yourself a little bit more with those counter-regulatory hormones that always kind of beat us down. Sometimes if you're going through menopause or you have a thyroid issue, there are some compounding hormones that might set you back. So extending your fast may actually help. Hey, Beth. What do you think about cleansing pills? Are they too harsh on your intestines? Yeah, I typically don't like a whole lot of supplements. Your body is actually a self-cleaning oven. Believe it or not, it's been doing this for thousands of years. It's figured out how to detoxify. One of the best ways to detoxify is to stop eating for a period of time. Give your body the rest that it needs. The liver will come in and clean itself out. Your kidneys flush out everything from your bloodstream on an ongoing basis. Your bowels do the same thing. Now, there are some people that have dysbiosis or irregular bowel patterns. They're constipated. Then their toxins are sort of stuck in their body. It's causing a lot of inflammation in their bowels. It's causing them bloating and gas and, abdominal discomfort. I still don't recommend cleansing pills. I'm really a food kind of girl, so I recommend doing good amount of fiber. Either get your citrusel out, drink lots of water, make yourself some vegetable smoothies. Do that as a cleanse as much as you can. A big fan of fermented food to try to kind of reset your gut microbiome, which also helps clean you up. There was a study that was kind of interesting. Our genetics don't change as rapidly, but the bacteria in our colon, they mutate rapidly. And now they've found bacteria in our colons that can break down BPA, plastic. So bacteria on our insides, in our colon, are working for us. They're helping us clean out these toxins. They're helping us detoxify. Also, they've found that vitamins are produced by these microbiome. And so that's also a great way of nourishing your body and cleansing your body, is working on your microbiome. Hi, Miss Karen. Will fasting work more efficiently if not using PPIs? Interesting question. So complicated. So PPIs, what are PPIs, guys? They're proton pump inhibitors. These are medications that people take all the time to control their acid problems, like omeprazole and Nexium and Protonix. And they've come under fire recently because it has been shown that taking these omeprazole, Nexium, Protonix-like drugs for a long period of time actually does some harm to the body. It shuts off your acid, so you are opening up a portal for bacteria to get into your small intestine where it's not supposed to be there. And so you get an overgrowth, you get a dysbiosis of all this bad bacteria that's fermenting and kind of counterproductive, working against you. So people that are trying to lose weight, people that have diabetes and have trouble controlling their blood sugar, people who have depression, people who are tired all the time, they may have dysbiosis from all the toxins and the bad bacteria that have entered. So know that that first we got to work off the PPI skin, and then once we do that, then fasting is always a great idea. If you wanted to combine the two of them together, I don't see any reason why you couldn't. I would start out gently, especially if you have other health conditions. You may want to start out by just squeezing your meals into into an 8-hour period of time, and then try to do more, prolonged fasting. Let's say you decide you want to do an alternate day fast, where one day you're drinking liquids like tea, broth, black coffee, you're doing some simple soups like miso soup, and then on the other days you're eating a regular meal. Oh, that brings up another good point. Also, try not to skimp on your calories in that 8-hour period of time. Make sure you're getting all your macros. Especially women, we tend not to eat enough protein in our diets, and that makes us more hungry later on in the day. And we tend to then carb load, which then is counterproductive because it causes our insulin levels to be all over the place. So if you are going to eat in an 8-hour period of time, just make sure you're getting your 3 meals, make sure you're getting your protein, 50 to 80 grams of protein a day. Make sure you're getting no refined carbohydrates, but complex carbs and fiber in your diet. And of course, have some good fats. You got your seeds, your nuts, your avocados, your olives, things that are great a source of omega-3 fatty acids to keep you satiated, so your body is not starving. You're welcome, Ivan. Karen. Tate, it's good to see you too. So just ask any other questions. If anybody has any more questions about intermittent fasting, again, we are trying to work on doing a lot of integrative work in our office. Just to let you know, if you are a patient of our clinic and have any questions, let us know. You're welcome, Beth. And we're more than happy to sit down with you on a one-on-one consult. Or if you're a practice patient, we do have group visits as well for common problems. If you see me in the clinic and you have any particular questions, let me know. Hey, Marita, I feel like I'm going to throw up. What does that mean? So anyway, if you feel like you have any further questions, let me know. Otherwise, I'm going to wrap things up. So here's a quick summary. Studies don't show that intermittent fasting is any better than calorie restriction in terms of weight loss. So if you can do a calorie restricted diet and you're happy with that and you're losing weight, good for you. Stay with that program. If you are struggling with reducing calories and you want something a little different, maybe try to change the eating schedule to like an 8-hour period of time. And then if you feel like you can go every other day fasting, that works for you, great. If you wanted to do a 4-hour day, 4 hours where you eat and 20 hours where you fast, you can try that as well. All right, well, I think I'm going to finish up here. Thank you all for joining me. For those who didn't make it to the live, I'm going to post it so that it can be viewed on later. And if you have any other questions that you want to ask me about, please go ahead and put them in the comments, and I'll try to do some more lives for you folks. Maria, unfortunately, we are close to new patients right now, but we're going to open up probably in the spring again. Thanks for checking in. You're welcome, Joanne. Have a good night, everyone.